Today we are discussing about benign prostatic hyperplasia, that is BPH, and more importantly the natural remedies to shrink the prostate gland. The prostate, we all know that it's a walnut shaped gland that is a part of male reproductive system. So the main function of prostate is to make a fluid that goes into semen and that is essential for man's fertility. The prostate goes through two main growth periods in the life of a man. The first occurs early in puberty, actually when this prostate doubles in size. The second phase of growth begins around the age 25 and continues during most of a man's life. So what is benign prostatic hyperplasia? Benign prostatic hyperplasia, that is BPH, is a benign enlargement of the prostate which contributes to a series of urinary voiding difficulties which impact quality of life among older men. The precise molecular mechanism of BPH are still not completely understood. But the recent research on protein misfolding may give hope on the pathophysiology as well as treatment. Benign prostatic hyperplasia is the most common prostate problem for men older than the age 50. Although BPH rarely causes symptoms before the age 40, the occurrence and symptoms increases with age. BPH affects about 50% of men between the ages 50 and 60 and even up to 90% at the age 80 or above. Some men with greatly enlarged prostates have little blockage and few symptoms, while other men who have minimally enlarged prostates have greater blockage. So from this we can understand that the size of the prostate does not always determine the severity of blockage or more symptoms. So less than half of all men with benign prostatic hyperplasia have lower urinary tract symptoms. These symptoms we can classify as early symptoms and late symptoms. The early symptoms, which may be urinary frequency, that is urination 8 or more times a day, urinary urgency, that is inability to delay urination, trouble starting a urine stream, and a weak or an interrupted urine stream. The late symptoms or complications include dribbling at the end of urination, nocturia, that is frequent urination during periods of sleep, urinary retention, urinary incontinence, that is accidental loss of urine, pain after ejaculation or during urination, urine that has an unusual color or smell. The BPH patients should be cautious when taking certain medications because sometimes men may not know when they have a blockage until they cannot urinate. This condition is called acute urinary retention, which can be a result from taking these over-the-counter medications for cold or allergy, that is decongestant such as pseudoephedrine and oxymetazoline, which has a potential side effect, that is they may prevent the bladder neck from relaxing and releasing urine. Also, other drugs such as antihistamines like diphenhydramine or levocetirizine can weaken the contraction of bladder muscles and cause urinary retention, difficulty in urinating, and painful urination. And this urinary retention also can occur as a result of alcohol consumption, cold temperatures, or a long period of inactivity. Mostly, urinary problems in men are due to an enlarged prostate gland or benign prostatic hyperplasia after the age of 50. And the hormonal changes after the age of 50, such as a drop in testosterone and a rise in other hormones such as prolactin, which stimulate the prostate gland to grow, and this may result in blockage of urethra. And our goal of any treatment for prostate enlargement is to shrink the prostate and improve its function. The right choice of diet and the physical exercise will help us to get rid of this problem naturally. The prostate contains more zinc than any other organ. So zinc is thought to help by reducing the size of gland, indirectly by blocking 5-alpha reductase and the same that converts testosterone into another forms that causes prostate growth. The natural source of zinc are lean red, meat, shellfish, and pumpkin seeds. I can tell you an easy zinc recipe with pumpkin seeds. Put some olive oil in a microwave safe packing dish and heat for 30 seconds. Then add pumpkin seeds and cook on high for 7 to 8 minutes. Now you get a daily usable natural zinc. Another nutrient is isoflavonoids. that help to prevent prostate growth by blocking 5-alpha reductase. So soy milk and soy yogurt contain more isoflavonoids than processed products such as soy bacon and soy sausages. As all of you know, omega-3 fatty acids are naturally anti-inflammatory. Men who consume these fatty acids tends to have smaller prostate, stronger urine flow and less urinary retention in their bladders. Monounsaturated and polyunsaturated fatty acids help to increase the permeability of cells and hence maintains the normal thickness of the bladder. Salmon, sardine and linseeds are rich sources of these omega-3 fatty acids. Remember, always prefer natural sources over artificial molecules since it absorbs only in optimal quantity and hence no chance of toxicity due to overdose. Tender papaya leaf with honey and turmeric powder also help to shrink the prostate gland. Daily intake of tender leaves of Cassia fistula cooked with olive oil will also give good result for BPH. Another important plant is saw palmetto, which is also called old man's friend because it's a popular remedy for prostate problems for a long period of time. Also, we should take care that foods with saturated fat, trans fat, cholesterol, sugar will damage the heart and also the prostate. Alcohol, especially beer, is a diuretic, which is the last thing you want when you are already making too many trips to the bathroom. Also, alcohol is harmful for prostate health, such as it will lower micronutrients like zinc. Self-care is more important in this era, which will help us to prevent chronic diseases, and for that public health awareness and health education is necessary. And this video is a humble beginning from my side, and for more videos like this please subscribe my channel.